Now we'll focus on how to help a victim who is unresponsive but breathing adequately. Normally, you should treat an unresponsive victim in the position found until they can be stabilized for transport. However, when an unresponsive victim is lying on their back, the tongue can block the airway. In this segment, you will learn how to place an unresponsive, breathing victim into the recovery position. This position allows the tongue to fall forward and fluids to drain. Use the log roll technique to place a victim on their side. If the victim is breathing adequately, use the recovery position. Grasp the hip and shoulder furthest from you. Roll the victim towards you, keeping the head, neck, and back in line. Position the victim on his side with the lower arm extended in front. Bend one or both knees. If you suspect the victim has a neck or back injury, use a modified recovery position. Grasp the arm closest to you and gently position it next to the victim's head. Roll the patient towards you as a unit, keeping the head, neck, and back in line. Bend both knees to stabilize the victim. In this position, the head is supported by the raised arm. You can use the recovery position when an unresponsive victim is breathing adequately, begins to move, or you must leave the victim to get help. You can also use the log roll during CPR if the victim vomits and you need to clear the airway. There is no single position that works for every victim. Make any small adjustments needed to keep the airway open and the victim in the recovery position unassisted. If the victim must remain in the recovery position for a long period of time, turn them to the other side about every half hour. Place a pregnant victim on her left side to keep the weight of the baby from pressing down on vital blood vessels. You will now practice using the log roll in recovery position on an unresponsive victim.